handy dandy, trusty, what? Wheelchair,
Wheelchair.
right? Our wheelchair. So with the wheelchair, I'm going to demonstrate as if you were transferring, because that's mostly we're going to, I'm going to demonstrate here if you're transferring. Now, you can have the legs here and extend the legs out and then press this to bring it back down, this little lever here. But if the person, say, has to have their leg elevated, now it's not elevated above their heart, but it's still elevated. Okay, but the first thing you want to do is there's a latch in here, a lever here on both sides, and you want to take the legs off, okay? All right. Now, truly the first thing you should do, so let me back that up. The first thing you should do is what? Put the brakes on, okay? So that's the first thing. So I'm gonna pull that back, pull this back, so that hopefully it's not moving. Then take your legs off. So I'm gonna have this as my affected side on my left side, and this right here is called a transfer board, okay? And people will use this. Sometimes they'll even have it here, and rest, they'll use it to eat. They'll take the board, and sometimes they'll have a little pocket, in the back. Just put it back there and travel wherever they need to go. So you have your grips right here where you can push and move back and adjust the wheels. Then you also have your other wheels in the front, and they move in a complete 360 degrees, okay? But the first thing I'm going to do, let's say I have a patient and we want to transfer from the wheelchair to a chair, or wheelchair to a bed. So what I need to do, and I'm going to move this out a little bit so that you can see, I need to take the handrail off. And so you can see there's a button right here. There's no button back here, but I'm just going to press that and lift that out, okay? So when you press that, that releases it, and now I'm going to put this to the side, okay? Then what I'm going to do is I'm going to put this chair here, and what you would do is if you had your patient sitting, now unfortunately I don't have a chair that has a handle, but if I had a chair or I had a bed or I had something that I could grab, then I would be pulling or holding that for balance. So what I'm going to do is I want to make sure that when I put this board underneath my buttocks, that when I'm about to slide, I don't put my fingers in this hole, because then when I'm sliding in and my weight is sliding over and transferring from the wheelchair to the chair or the bed, I don't crush my fingers. So you want to keep your hands up here, okay? So you would tell the patient, just lift up a little bit and have the board underneath them. And then what they're going to do is they're going to push like this and slide over. Then once they get here, they're going to take it off. Same thing. I can have them lift, and this time I can hold on to the railing. So then I'm going to hold on to this, slide over, so I can slide down, lift my buttocks, and then take this off, put it behind me if I have a little pouch in the back, or here, or give that to them, okay? So this is how you're transferring from the wheelchair to a better chair, or the better chair to a wheelchair. Sometimes you'll have a patient who cannot ambulate, or they can't even move from one place to another. You must be careful and understand your scope of practice. As medical assistants, even though you're being exposed and trained with certain things, you actually are not supposed to move people from one place to another. That's not really in your scope of practice. That's really a CNA, because CNAs are trained to transfer correctly without hurting themselves or a patient, to use a Hoyer lift, okay, if you've ever seen one of those where you put the patient in there and that's what CNAs do. Medical assistants, you're trained to assist the physician in the doctor's office, which means that when you have patients in the waiting area and they're like, can you help me get up? Be careful in doing that. Can you try to get up, sir? Or, I'll hold your arm and maybe your back, and if you want to rock and then try to get up, I can help you, but do not bear their weight, because you'll throw your back out and you're too young, you've got too many years ahead of you to be walking around with back pain or be injured because you really haven't been properly trained on how to transfer or lift a patient, okay? Because it truly is out of your scope of practice to do that. I have seen people do that, and if you are a CNA, I know some of you are CNAs, and you know how to properly do that, then okay, you can do that, but just understand that in the scope of where you're working, if something were to happen and you were to say file a workers' comp claim, I don't know if it's going to be paid. I'm just saying I don't know, okay? Because you really are doing something that's out of your scope. If you're in a nursing home or assisted living facility, of course, yes, that's what you do every day, all day, right? Transferring patients. But we can teach patients how to do this. So like I said in the very beginning, there's some things like the Hemi walker that you may not be dispensing. You may dispense a quad cane, but maybe not a Hemi walker. You will dispense crutches. You may not dispense a rollator, but you might see somebody doing something using it not properly. You might have to transfer somebody from a wheelchair. Now you can help them to get from the wheelchair up onto the exam table, and you can shift them. There's a way that you can do that to shift them, but you're still not bearing the weight. Okay, it's a little different. And we can treat patients in a wheelchair. We don't have to get them on the exam table for everything. Many a day, I've gotten right on the floor and did what I had to do, and doctors will do that if it calls for that, okay? I just don't want you to hurt yourself, you know, trying to accommodate that patient or allowing that patient to manipulate you into doing something that could cause you harm or cause them harm, okay? All right. Any questions